Thomas, this question is for you. I'm joking. This is a bit of a hectic one. Okay, so one of the ladies asked, how do you navigate this? Your boundary is not to be intimate because he refuses to go for help, and being intimate does not feel safe. So now he can use this as an excuse to act out.
I think so many of these questions are very much like from case to case. Like I think we spoke about last week, every marriage is different, it consists of two different people. Therefore, every marriage would be different. So I think it really comes down to, in my opinion, you would rather want to put pressure on someone to get help, so you would want to put boundaries in place. Whether or not those boundaries work is an entirely different story. But I think, even if there is some acting out that stems from it, like surely like the pressure that gets put on him to seek help would outweigh any form of acting out that may come from his side. Because I think, once again, like there are some men that are very receptive to these things and some men who aren't, so I think in these cases, it could go many different ways, but I think, rather put in boundaries. And if there is acting out, like maybe within time, it will put enough pressure on him to actually want to seek help. That help might not come immediately. He might not immediately say, okay, now there's boundaries, so I'm going to get help. They might be acting out, they might be blaming, he might make you feel bad about it, like this is all your fault because you don't want to be intimate with me. And I think in those cases, like we always speak about the importance of self-care, is because when you go through those moments that you're able to stand up for yourself and be like, no, this is nothing to do with me. This is everything to do with you. And this will only change or get better when you decide to get help. So it's not like I'm withholding intimacy from you forever as like out of spite. I'm withholding it until we could get to a point where there's healing in our marriage. And I think that will always come like with some form of opposition in the beginning. I think in some cases, there are some ladies where it's like in the beginning, their husbands get caught and there's a huge amount of remorse, there's a huge amount of guilt and shame, and they're very desperate to get better. And I think that's amazing. But that doesn't happen every time, unfortunately. And I think, in my opinion, I would rather put pressure on the person to get help, even if there is some form of acting out that comes from it, and some kind of blame that gets put onto you, because I think we really got to know the difference between right and wrong and kind of stick to our guns. And I think at least, there's like a whole bunch of like a whole panel here that's all saying that is the right thing to do. The only one that's saying it's wrong is your husband who's acting out, so I think you kind of take the like wisdom from counsel of many versus the person who's in a position who actually needs help. I think that's the best way I could answer that question.
If I may just add to that, that was well said, Thomas, is that for myself, I would swing that question around into, if you do away with your boundary, and you do give him sex, will that stop him from acting out? Because in that last answer as well, it won't stop him. And I think we've said there's plenty of times that the sex addiction is not about the sex. It's about the fact that he can't regulate emotions, can't face reality. He needs a crutch. So even if you don't have that boundary, he's going to act out. Even if you do give him sex 20 times a day, he will still act out because he's an addict. So we need to just clarify that. And the thing is that when I speak to ladies and they do cross that boundary, a lot of times they come back with a lot of resentment because now they've given themselves fully 100% access, and he's not taking any responsibility. So he's still acting out. And sometimes he'll act out with you during the sex because he's just watched porn before, So you feel unsafe. You feel these things. He might not say that, but you feel it inside your body. You feel it in your nervous system. You don't feel safe. And that's important to know, so I just wanted to throw that in there. So it really, if you don't have boundaries, and he's not willing to go for help, it will really chip away from your sense of self-worth if you give yourself fully, like 100%. Like I always believe there needs to be balance. There must be, if you give yourself 100%, then he needs to show some responsibility. Otherwise, there's going to be resentment. all the way, and that we all know where that leads. So that's just my opinion.
Yeah, okay. So as far as I'm concerned, that question boils down to sex is a need. That Maslow's hierarchy of needs, sex is presented as one of the most important human needs, you know, along with shelter and food. And I don't agree with that. I do not believe that sex is a need. You know, it's a want, it's a nice to have. No man has to have sex. You know, if you have tools and support, most men would be able to go for prolonged periods of time without sexual release. You know, so that question for me has something to do with that. You know, I can't help myself. So now, if I'm not going to get it there, I'm going to get it somewhere else. And that is a horrible way to work, to sort of or to go around with life, you know. That means that you are not in control of yourself, and that actually highlights the point that you would need help and support. So I hope this makes sense, and I'd love anybody else to comment on that, but that's sort of the sort of line that I would come from, you know. So, and then the second thing that goes with that is, I think the fact that safety is super important. Safety is super, super important. If you are not feeling safe, if there's no connection, then that for me takes first priority above the needs or the wants of the person, the other person that's involved. And then the next thing that this boils down to, this conversation boils down to, is the fact that I do believe, and I've seen the damage in the hearts of ladies, that if a husband's busy with pornography, that in fact is, in my estimation, at least, and I'm sure most other people here would say the same, that is abusive, you know. And if you're being abused, you need to get out, you need to make sure that you have safety in place. So I hope that makes sense. Al?
I want to add to what Kenneth just said. I mean, setting a boundary is to protect your emotional and physical well-being. And by not being intimate because you're not feeling safe, you are allowed to protect yourself. So for me, and from my past experiences and stuff, setting that boundary was for me to protect my well-being, and I'm not feeling safe with him. I couldn't allow myself to be with a person that I don't feel safe with. So if he's going to come back at you and say, but you're withholding it from me. No, I don't feel safe with you. That's why I'm setting this boundary. Until then, I'm not allowing myself to be intimate with you.
Yeah, I think it's very clear. I think all the answers were really good. And I think Maslow's hierarchy also has sex as a need mainly because we need to reproduce in order to survive. So humans cannot survive unless we have children. So that's essentially why it's there. It's not because like you're going to die if you don't have it. It's just like the human race will no longer exist if we don't reproduce. Look, I think there are like instances where I think you would love to get your relationship to a point where it's more about intimacy versus having sex, if that makes sense. I think there are instances where, let's say, like the husband really works on their recovery, they've got years of recovery, and then it's like, well, sex is not a need, so then we'll be married, but we won't have sex. You know, I think we don't want to end up going to the other extreme. You know, we want to get to a point where it's like we are intimate because we love each other and our relationship is just so special that this kind of happens naturally, and we want to both do it. You know, in a way, it's like it's nothing really about the kind of pleasure elements. It's more about us connecting and having a healthy, loving, caring relationship. And I think that would be the ultimate goal. But until you get there, like it's not a need. You know, we've had many men go through this process where they wait 3 months, 6 months. We've had people wait a year, 2 years to get to a point where they're intimate. And I guess it very much varies from case to case. But those men were fine through that process, and they worked hard. They worked through it. They understood it. And when it actually got to a point where intimacy was brought back into the relationship, it was the sacred thing again, which I think it's meant to be. It's meant to be sacred. I think pornography steals that. So yeah, I think I agree with everything that's been said.
And thanks for bringing the balance in there, Thomas. We are not anti-sex. I think men are like, yes, grace Allah, they teach the woman not to ever have sex again with their husband. That's not the heart at all, you know. We celebrate sexual contact. We do believe, like Thomas said now, that it has to be in a safe space. It's more about the intimacy and the connection than the sexual release. And yeah, so I fully support that. Thanks for that, Thomas. So
Someone asked, how can I tell if my husband has any psychiatric or co-occurring conditions? How do I know if he's generally struggling with depression or suicidal thoughts, or if he's just using these claims manipulatively? So how common is it that there's co-occurring conditions, and how does it work when someone like that is on the program?
So co-occurring disorders, so that would mean basically sex addiction and something else. So in this instance, we're talking about some kind of mental health issue. So one of the things with that I've noticed, especially with people who struggle with pornography, is ADHD is often present. You know, so ADHD, one of the symptoms is something what they refer to as hypersexuality, which means they have a very, very high sex drive. And then also one of the other symptoms is literally increased, like they basically take a lot of risks. You know, so they're very like impulsive and compulsive. So it's just a bad combination because you have a very high sex drive and you're very prone to taking very high risks, you know, especially even if there's danger involved. So that's where I notice like a lot of younger people get introduced to pornography often have ADHD. And then there's like bipolar type 2. So bipolar type 1, when people hear bipolar, they think there's this hectic presence issue that's very easy to notice. There'll be these major mood swings. There'll be these like major issues that are present. And you've actually got bipolar type 2, which is a lot harder to diagnose. So that's often comes with like moments of depression. And then the mood swings are much more rare, very like, don't occur as much. And then there's like these things that they refer to as like the highs. So bipolar is like highs and lows. And the highs are so small that it's very, very difficult to notice. So I think it's one of these things where it's like I would keep an eye out for like depression, you know. So I think depression is a little bit easier to identify, where the person will look down, they will look like they'll have moments where they just really look depressed and don't have much of a will to get out of bed and go out and do things and socialize. And in those cases, like I would definitely recommend you know, at least just going to a psychiatrist and discussing symptoms, you know. And I think finding the right psychiatrist where you're able to just discuss symptoms, and not just immediately get put onto medication. But I think, you know, the thing with psychiatric symptoms, like I've had to study for many years and work in the field for many years to be able to identify these things. And it got to a point where now when I work with a person, I can. But for the average person, it's exceptionally, exceptionally difficult. And I think one of the things is if there is like major mood swings, not a lot of stability at home, one of those things where it's like major road rage, or comes home and kicks the dog kind of thing because they've had a bad day at work, you know. I think then sure, like there's nothing wrong, especially depression as well. Depression is one of those things that really stands out, where you would want to get treatment if it's reoccurring. Like if you're an adult and it's reoccurring, then like antidepressants has a really bad name, because the old antidepressants really would hurt a person's libido. It would cause all kinds of side effects and have all kinds of issues. So people would take it, they wouldn't feel good, and then they're like, meds suck, you know, like it's horrible. Psychiatric medication is destructive, it destroys, and it's horrible. But in actual fact, it really just means like there's a lot newer medication that's a lot safer. And some people will try one medication that doesn't work well. You're supposed to then try a different one. You're not supposed to just decide it's horrible, it's bad, I've had these side effects, so medicine is witchcraft, which some people actually refer to as witchcraft, which is quite interesting. You know, and I think it's one of these things where there's nothing wrong with having some kind of a screening process if there are a lot of like instability in a person. And if someone does try medication and there's side effects, my biggest recommendation is to then speak to the doctor and say, I'm having these side effects, because it's really easy for the doctors to say, okay, let's try this one, because this one, if it gives these side effects, this one won't, in our general understanding. The other thing is with bipolar, a lot of the times antidepressants will make a person not feel comfortable. And that's one of the ways they actually realize a person as bipolar, is certain antidepressants will make a person feel much worse when they take them. So bipolar type 2 is really difficult to diagnose, but the two things that generally means like it's impacted a person's addiction in a negative way, if there is a co-occurring disorder, would generally be ADHD and bipolar type 2. If you speak to any psychiatrist, they would tell you that. And I think once again, that's the best way I could answer it. I think a lot of people are resistant because the second I'm on medication, it means I'm admitting there's something wrong with me. And I think that's such a backwards way of going about it. Rather, if I drink a tablet every morning and my life completely transforms, like, is that really a problem? Like, it's more of a blessing, but it's difficult for people to actually acknowledge.
I think many of these symptoms will be presented like long before the addiction issue has come up. Generally speaking, we do not find a lot of people that has depression. I think the opposite is that most people on the program are labeled to have some sort of narcissistic personality disorder or something like that by the partners. I think that's a very rare it's very rare that people really are true narcissists. But I think when people are involved with any addictive behavior because of the numbing effect and the self-justification that involves being an addict or being addicted or escaping essentially, and managing the instability and the chaos of my life, there are some certain narcissistic tendencies that would come as part of that. So what I normally do is, if there's an issue that somebody complains about, or the partner says that the person is depressed or whatever, then if that doesn't radically change within the first 3 months, then I would definitely refer them to go see a psychiatrist or a psychologist. We do refer. We're not a psychiatric or a psychological organization, so we do not diagnose that. That needs to be diagnosed by the proper people. But if things don't change, then we know that there's an issue that they need to resolve. And then in many instances, even the worst type of narcissist becomes soft and pliable and open and vulnerable and connected emotionally. They're just narcissistic because they've shut down their emotions. They don't know what it is to feel anymore and what it is like to be a human being. So then people start to shut off and then they have all these egocentric behaviors. So narcissism is something else. I think that's sort of my addition to it. I don't know if anybody else here on the panel would like to add. Bev, you also got a lot of experience with seeing these things, and often in our multi-team discussions, it will come up. We've had a guy recently, also like 6 months ago, Thomas, you'll remember who that was because you also worked with him, and people were like, this guy is like sociopathic, there's something hectically wrong here, and we referred him to somebody else, and that's not the case. It just seems like it because we're not trained in that field. But there are signs that Thomas has referred to that we can see. So yeah, Bev, would you like to add to that?
I just want to kind of give an overall summary of what to look for if you think somebody's having some psychiatric problems. So I'm going to give a quick summary. So if you've got pen and pad, notepad, you can write this down. Or Estelle, I know you're brilliant at summarizing things on the chat, if you could do this. First of all, behavioral. What is the person's behavioral like? Thomas has already also touched on this. So change in behavior from the normal routine. Are they coming across? Are they suddenly doing something very weird over a period of time that they can't explain, and it looks really abnormal? So behavior is one. Then the next one is emotional. How's their emotional well-being? Are they now erratic? Are they having road rage, like Thomas said? Are they suddenly shutting down? Are they withdrawing, not wanting to get out of bed? Are they now just wanting to go out and drink all the time, whereas normally they wouldn't do that? So, and are they not actually talking about any emotional stuff? They're just not shutting down. They're just shutting down. So it's behavioral, it's emotional. Then we get to cognitive. How's their mental normal functioning? Are they able to think properly? Are they planning as they normally would? Are they communicating? Are they, if they're a business person, how's the business doing? If they're doing a normal, every other job, in being employed, are they able to go to work? Are they able to do their job properly? So that's cognitive, to do with their thinking and their planning. Then we come to self-harm. Are they doing any self-harm? Are they cutting? Are they wanting to break their fist in the door? Things that they wouldn't normally be doing. Then we get to substance abuse. I've just said again, they might go out drinking a lot more, or maybe they using their addiction much more, it becoming really much more than it normally would be. And then their physical health. What's their physical health like? Are they complaining of things that give them pain, or headaches that are ongoing, or things that they wouldn't normally have? And if you go to the doctor, there's nothing that can be explained, unless maybe it's stress, because that's very often what the doctors do come up with, which is very often the case. But if there's not even that, then it could definitely be linked up directly to some kind of psychiatric or emotional disturbance. So, yeah, I think that kind of summarizes it for everybody. Kenneth?
So the next question is, how can I help my son not to be the man, husband, and father his dad is? I think in essence, what she's asking is, how can we prevent that our kids don't go into the same way, that where there's addiction and where they don't function as an individual properly? How can we prevent that? That's the question in essence.
What's your thoughts on that, Maria?
So for me, Kenneth, I think it's because addiction is the inability to sit with your emotions. I would teach my kids how to really sit with the emotions. I would normalize the fact that, you know what, if I talk to my son, I would ask him, how are you feeling? So there needs to be emphasis on what are you feeling? How can we deal with big feelings? And I think the second thing is to do for my kids, I would say to them, it's okay to go for help. If you feel that you're not coping, it's okay to go for help, to normalize that as well, because in the schools, there's the stigma, going for help makes you weak. You're not a man if you go for help. And that's what we need to break. So I think, to normalize that it's okay to go for help. And when you go for help, it's because you're strong. It's not because you're weak. And I think the other important thing is sometimes is to never belittle the father, because kids internalize both parents. So they go in their mind. So if my mom says my dad is bad, that makes me semi-bad. I'm the mini bad in this family. So unfortunately, they do internalize stuff, which we need to be looking out for. But I think for me, it's just like talk a lot about emotions, help them to regulate, teach them skills to regulate, because that's in essence what addiction is. It's you're not dealing with emotions. So I think to prevent would be simply talk about emotions, help them regulate, sit with them. They mustn't run away from big feelings. So that's what I would do.
Yeah, for me, it's all about the connection and the relationship. And I think a hard topic is, I get asked this a lot: should you block their phones? I think blocking a phone is a very good way to prevent, blocking access to pornography is a very good way to prevent first exposure. But I think actually it's a horrible method of intervention, because if the child wants to watch pornography and you're blocking it, we're feeding the rebellion. It makes the whole problem worse. And then the wives or the partners, whatever, would say, but then are we saying we give them access? And I'm like, no, we're not. The answer is obviously not to give them access, but to block it drives the rebellion. So it's a bit of a catch-22. So then they're like, how do I help my child? I don't think blocking access to pornography is help. That we should definitely have stumbling blocks, but I think helping someone to not view pornography would be to build a relationship with them, to talk to them, to break down the shame, to connect with them, to engage with the issue and not try and find a cheap, quick fix. Blocking a teenager who wants to view pornography's phone, blocking his access to porn is not helping. That's not the solution. The solution isn't just, I'm not saying don't do it. I'm also not saying do it. I'm just saying that we need to think about the impact of what we are doing. And if it takes away from the relationship, then we're heading towards driving the problem deeper. Thomas, what's your thoughts on what I just said? Is that making sense? It's a tough one, eh? I'm thinking my kids, if they watch porn, I'm going to block their phones forever, but, like I'm realizing that probably won't help. In many instances, it can make the problem worse. What's your thoughts?
I think it's, I mean, this topic has always been so widely debated, and I think, like for teenagers, I think it would be good to get your kids to a point where when they're teenagers, you're able to talk to them and educate them. Like if they are exposed to it, that you're able to say, hey, this thing's really bad and it's quite harmful. Let's sit down, let's talk about it. I think generations have changed. Like when I was a kid, sex was a taboo topic. Like you would not talk about it. And I think that's actually quite harmful. Like I wish my parents would sit me down and discuss how harmful certain things are, and pornography is dangerous. And, when you're in a relationship, like these are the steps you're supposed to follow, and you're not supposed to be doing these things when you're your age. I think that's really good. But I think there are like 7, 8, 9-year-olds who have cell phones now, and there's 4, 5, 6-year-olds who even younger who have tablets and are on YouTube and all kinds of things. So I think blocking putting age restrictions on devices is a good thing, especially like if you're a 3-year-old and you're using a tablet, like you don't want them to accidentally come across something, and that would be 6, 7. Like when you're 8 years old, you have no idea what's right or wrong at that point. But when you get to the point where you're about 14, 15, I think like you're in a position where you're able to kind of know the difference between right and wrong. And I think at that point, like the more you start to block when they're teenagers, it can often cause a little bit of like a you versus me. It's like we're trying to block everything. We're trying to get in your way. And I think at that point, like it's so good to get to a point where you actually have conversations with your kids. You sit down, you take them out for a coffee, and you say, hey, this is like an us time where we're going to sit about how you're doing. How's your friendships? How's your, love interests? How's your whatever the case may be? And are you aware that these are certain dangers or risks? Because I know when I was younger, if I did something wrong, I don't blame my parents for it. It's just like sometimes you just don't know any differences. I'll get caught for it. And it was either like it's a sensitive topic, so we're just going to sweep it under the rug and pretend it never happened. Or I would get a hiding, but then like nothing would ever, like there was no follow-up discussion. It's like you're in trouble because this happened. But it's not like we sat down and discussed, okay, how can we help you? This has happened, it's bad, it's wrong. You're in this situation. How can we help you get you out of the situation? It was just swept under the rug, or you got a bit of a hiding, and then nothing really changed. I just got better at hiding the problem. It just never, it never fixed anything. So I think a lot of parents, like, when they join these panels, like, and their kids are a bit older, it's more difficult to start to implement and change rules because there's a bit of a resistance. But I think when you start when they're a lot younger with these things, it makes it so much easier when they're older. And I think even if they are teenagers, like rather than being suppressive, like sit them down and be like, we care about you, and how can we help?
And I think, and I'd love to hear Monique's view on this. This has an implication on the husbands as well. If my husband's watching porn, block his phone. That's not helping anything. And in the same breath, I'd like to say, if I can get my teenager to put the blocking app on his phone, that would be a real win. Then I've got his heart. Then he is fighting the same monster I'm fighting. It doesn't have that rebellious impact. So And I mean, if my husband doesn't have, or my, like I don't have a husband, but if any wife's husband here doesn't want to put the blocking software on his phone, that would also raise a concern. Now that says something. Why would you not want to do that? But getting him to do that under force is not helping anyone. That's actually just causing bigger problems. It drives the problem deeper in. So appreciate that. Yes, Monique?
I wanted to go on what Thomas was saying about this challenge, you kind of challenging him. My son's phone is blocked. He's been in the program now for about a year. We have, slipped up and the phone's maybe not blocked for some reason. Maybe he needed to update a game or something, and we had to open the apps, and then it opens and I forget to block it again, and then he would watch it. Or he would, he's even said in his sessions that I like to check whether it's still blocked. This is a challenge to me. I need to see if it's still blocked. So I agree with that. And I also agree with if I could get him to put the block on his own phone, that would be the win. Because being this little police woman standing behind him, making sure everything's blocked. Every night I go to bed and I make sure his phone's locked and, all of that. So he can't be on his phone until what time or that. That's not the kind of mom you want to be. You want to be that mom that trusts her child. And I want him to have a normal life, because we didn't have pornography growing up. We were, I don't know whether we were sheltered or what, but we didn't have that. So we didn't have phones that were blocked, or, we had like sleepovers and we didn't sleep. You would then just eat sweets and watch videos or whatever the whole night, but there was never pornography. We didn't have that. We weren't exposed to it. He was exposed to it. His phone was not blocked as let's say a year ago. There were no apps or anything blocked. We didn't have that because I did everything right. I had the conversations with him. I had the warnings with him. We have a very, very close relationship, and he was exposed in school with a friend. A friend showed it to him, and he was absolutely hooked. And we've been fighting that fight ever since. So the struggle to me, yes, is I don't want his phone blocked. I want him to make that decision. We were taught God gives us choices. It's very easy for God to say, no more sin, kabam, no more sin. But he gives us the choice to either commit sin or to not. And I'd like to give my son that choice. You decide. What do you want to be when you grow up? I don't want to be in control of what type of person you're going to be. I can lead you, yes, and I can try and keep you on the right path, but I don't want to block everything. He's in high school now, and all his friends have got Chat GPT, and they're having so much fun, and they've got normal YouTube, and they've got Facebook, and all his classes, they're sending stuff, Facebook links and everything, and he doesn't have Facebook. So he has to come to me and he has to ask me, can I please just forward this to you so I can open it on your Facebook? I don't want him to have that life. I don't want him to sit in class and the kids say, oh, check this link. And he's like, oh, I can't. My Facebook's blocked. Why is your Facebook blocked? You in high school, dude. Why is your Facebook blocked? So I agree with that, to get to the point where he can put the block on his own phone. Yes, 100%. I agree with that.